Hello. So my friend and I were having a conversation about Western versus Eastern medicine philosophy and how they approach diseases and symptoms differently. And I just thought it was like a pretty interesting conversation. So I thought I'd record it. So yeah.
I'm gonna record
Fuck
it.
you.
No, no, I'm not gonna you don't have to. I won't identify you, whatever.
Yeah, yeah,
But
yeah.
I think this gets into Western philosophy of medicine. For example, I talk about this with my other med school friends. From my perspective, Western medicine treats diseases and sorry, they treat symptoms. They don't necessarily treat the disease or disorder, and they come from it
Mm,
from a more post diagnosis perspective, whereas Eastern medicine or traditional Chinese medicine approaches like treatment as more as preventative. It's like that old saying like 病从嘴入, right? Or something like that. Have you heard that saying?
mm, mm-hmm.
So that's kind of how that's what my perspective is right now. It's been my perspective for the last 3 4 years.
Mm-hmm.
Since I think I don't know, just since having a lot of fucking med school friends and just reading when breath becomes air and being mortal and just other more med related things, it
Mm-hmm.
has shown just exactly like how much of the Western medicine is different and compared to Eastern medicine, and also how much Western medicine takes from like quote unquote alternative medicine and calls basically I mean it is cultural
Yeah,
appropriation.
but
They fuck.
traditional Chinese medicine is pure bullshit. It's even more
No, I
bullshit
know,
than
I know. Well,
this modern psychiatry stuff.
I'm not gonna call traditional Chinese medicine bullshit because there are some science behind it in terms of trial
I
and
mean,
error.
sure. Yeah, sure, but if you look at the meds they prescribe you, the regulation is also very wonky.
Yeah, you're right.
It's
Like fucking
huge.
tree roots and
Like I
bugs and boiled. Yeah, 知道中药
Yeah, not even that. There is also the controversy about 中成药, which is
what's 中成药?
you can Google it. It's basically Western medicine wrapped in Chinese traditional Chinese medicine form,
Oh, interesting.
but the effective ingredients all come from Western medicine, but they would label it Chinese medicine. And oftentimes they
Oh.
would add extra effective content um, higher than the thresholds that is thought to be safe for Western medicine. And that is because of
中成药
regulation. Yeah.
it's lower.
There's a lot of
中成药属于中药，是完成由中药成分加工而成的成药。它的主要，它主要只在中医药理论指导下，以中药材影片为原理，按照国家药品管理部门规定的处方生产工艺和质量标准制成一定的自行药品 whatever the fuck. Okay.
mm. Do you think depression is a real thing? Like, we don't have any evidence of the actual mechanism of it.
I mean, God, this gets so philosophical for some reason. Okay, what is real, right? Like reality is morphed by perception. If I'm waking up every day and I want to kill myself or I have no motivation to do stuff, then that's real. Like to me,
No, I'm just
depression.
saying it's no. I'm saying if something is scientifically quote unquote real when it's falsifiable, but we don't
No,
have any.
no,
All
wait,
we
no,
have is hypothesis.
wait, no, you can't. Wait, no, you can't. I thought. Wait, that isn't. Wait, what? Wait. That's what that is. But then, what about God? Like, you can't prove a negative.
Yeah, so it's not real.
I mean, you can, but I mean, what do you mean you can't prove depression isn't real though?
Anyways, what I'm saying is that we don't know the actual mechanism behind it. We don't have a pathology of it.
I mean, yeah, that's fine. There's so many unknowns in science that isn't discovered yet. I'm not gonna say it's
Yeah,
not
so
real just
why are we
because.
treating it as a disease?
I mean, because this is kind of trial and error, right? Like science isn't about getting the perfect solution at the first first try. It's about trying other things until it works and then optimizing it.
So we're just prescribing SSRIs to a disease that's not whose mechanism we don't even understand.
Well, I mean, yeah, that's the same. This is the same thing with fucking vaccines and masks when COVID came out. Like people were bitching, complaining about masks, and they're like, "Oh, they first said mask on, now it doesn't work that much. Now they're like mask again." Like, yeah, like because it's a new disease that no one has ever, like, no one on Earth has done a significant amount of research on, and for the time
Yeah, there
being,
we
this is
know
the
it's a
best solution.
disease. We know what causes it,
Yeah, because it's
and
easier
we
to.
don't
Yeah, but
even know if.
I mean,
But
fuck,
what I'm
what's
saying is, we don't even know if depression is a real thing or
Yeah,
not.
yeah. But what's that thing in cog sci or psychology? Like the brain studying the brain, there's gonna be some gaps or something, whatever the fuck that theory's called. Like there's like I mean, this could be one of those things. Like there's only so much you can find out about diseases or I guess depression in so much as it affects everyone differently. Because like depression is
Sure.
I
I
mean
mean,
that's
why
what
don't
I
we
mean
just treat it as a feeling?
because the feeling subsides. This isn't going away.
I mean, it has it has a time horizon to it.
There's no time horizon to it if they kill themselves. That's you can't call that time horizon.
What? What I'm
Like
saying is
what time horizon are you talking about?
the horizon of a feeling, of
No,
an emotion.
no, depression is waking up every day and feeling like you want to kill yourself and not wanting to do anything. When is
For
it
three
when has
weeks.
that gone away? No,
For
that's
three
not
weeks.
wait, that's like the minimum? Like is that we're saying that's the diagnosable
Yes, yes, that's the diagnosis in DSM-5.
let me see. Depression criteria.
It might be even shorter. It might be 2 weeks.
Yeah, so 2 weeks. I mean,
Yeah.
yeah, like yeah,
So
then the
it's really short.
yeah, but 2 weeks feel like to feel constantly sad and no motivation for 2 weeks is pretty long, dude. Even 2 days is long for me.
Sure. So why is that a disease?
I mean,
Feelings can
that's
last long too.
wait, sorry, say it
Why
again.
why do we think what I'm saying is why do we think of something that is mental and psychological as something physiological?
Because it
Why do we
affects the
have to
because of
use
because it affects the physiological. Like it's not like there's no it's they're connected. Like everything in the body is connected. It's not like you feel like put it this way, right? Like if I don't sleep well, I can't work out as well, which will in turn also produce less dopamine and affects my ADD. Like it's negatively impacts my ADD symptoms. Like it's not like just because it affects your brain, it doesn't affect your body. Like they're all connected. You should know this.
Yeah, but when we talk about a physiological disease, we only talk about the physiological aspect of it. So why when it comes to quote
The
unquote
brain.
mental health disease, we somehow link it's a very pre-modern way of thinking when you link physiology uh with your feelings with things that are subjective.
I guess.
Anyways, I'm not like I don't know the answer.
Yeah, yeah,
Anyways,
I
that's
know.
the
No,
point.
I mean, I understand where you're coming from. Well, because I guess in a way, like everything is physiological. Like you can like the biochemical pathways in which the like serotonin gets
Yeah,
uptake.
what I'm saying is this biochemical explanation of depression is probably fucking bullshit.
I mean, maybe it could be. I mean, how? I mean, definitely don't do enough research to know this. So,
Yeah, and why do we trust these quote unquote medical professionals so much when it comes to mental health
well, because
stuff?
they've done enough. I guess the idea is like they've done enough research. Yeah, you can say this about everything. Then, like, why do you trust doctors with limited, like, in a field that's limited? It's because they've done the most. They've had the most experience in that limited field.
I feel like Buddhist monks know more.
I don't know about all that. But I guess you could also like I mean, this kind of goes into like whether depression is like a disease caused by modern society or whatever the fuck. Like then because then that's why a lot of fucking white people go like find themselves in fucking like to be monks and shit.
Sure.
I mean,
Anyways, we don't have to we don't have to discuss this for now.
oh yeah, whatever. It's not. I mean, I'm not. It's not like I have a personal attachment to this, but I get where you're coming from. But I also see the merit in at least having a solution. It's better than nothing. But I mean, there's also been studies on like not using medicine to treat disorder, or sorry, it's like mental disorders, like CBT, like sorry, cognitive behavioral therapy, or like just yoga, stretching, and like different types of like meditation, et cetera, et cetera, et cetera. So,